Japanese encephalitis was first recognized as a distinct clinical entity in Japan in the 1870s. The virus that causes the disease, however, was not isolated until 1935. This discovery was a significant milestone in understanding the disease and its transmission. Zhi is a mosquito-borne viral infection that primarily affects the brain and can lead to serious neurological complications. It is most prevalent in rural areas of Southeast Asia, the Pacific Islands, and the Far East. Japanese encephalitis is a disease caused by the Japanese encephalitis virus, JEV, a flavivirus related to dengue, yellow fever, and West Nile viruses. The primary route of transmission for JE is through the bite of infected mosquitoes, specifically those of the Culex species, primarily Culex tritonirhynchus. Here's a brief overview of the infection route. The primary natural reservoirs of the virus are birds and pigs. In these hosts, the virus multiplies and maintains a cycle between mosquitoes and these vertebrate hosts. Pigs, in particular, are significant amplifiers of the virus because they can develop high levels of viremia, meaning a high concentration of virus in their blood, which is sufficient to infect mosquitoes that bite them. When a mosquito feeds on an infected animal, it can acquire the virus. After an incubation period within the mosquito, the virus can be transmitted to humans and other animals when the mosquito feeds again. Humans are considered dead-end hosts for JEV, meaning that while they can become infected, the level of virus in their bloodstream usually does not become high enough to infect other mosquitoes and continue the transmission cycle. This is why human-to-human transmission through mosquito bites is extremely rare. Once a person is bitten by an infected mosquito, the virus can enter the bloodstream and may eventually cross the blood-brain barrier to infect the central nervous system, leading to inflammation of the brain, encephalitis. It's important to note that most JEV infections are asymptomatic or result in only mild symptoms. However, a small percentage of infections result in severe clinical illness, with symptoms including high fever, headache, neck stiffness, disorientation, coma, seizures, spastic paralysis, and ultimately death in some cases. Prevention of Zhi primarily focuses on vaccination and mosquito control measures, as there is no specific treatment for the disease once it is contracted. Japanese encephalitis, Zhi, is a viral brain infection that can have serious consequences, although most infections are either asymptomatic or result in only mild symptoms. When symptoms do occur, they typically appear 5 to 15 days after being bitten by an infected mosquito. The symptoms of Zhi can be categorized into mild and severe. Mild symptoms: fever, headache, vomiting, diarrhea, fatigue, general malaise. These mild symptoms are often nonspecific and can be mistaken for those of other viral infections. Severe symptoms: in a small percentage of cases, the infection progresses to involve the central nervous system, leading to more severe symptoms, including high fever, neck stiffness, seizures, especially in children, disorientation, coma, tremors, muscle weakness, paralysis, neurological sequelae, long-term complications. It's important to note that severe Zhi is a serious medical condition requiring immediate hospital care. The severe form can lead to long-term neurological disabilities and, in some cases, can be fatal. The risk of developing severe symptoms is higher in certain. Japanese encephalitis, Zhi, is a serious viral infection, and there is no specific antiviral treatment available for it. Treatment primarily focuses on supportive care to relieve symptoms and manage complications. Here are the key aspects of treating Zhi. Patients with severe Zhi usually require hospitalization. This allows for close monitoring and management of complications, which can be life-threatening. The mainstay of treatment involves supportive care, which includes maintaining fluid and electrolyte balance, ensuring adequate oxygenation and airway protection, especially if the patient is experiencing seizures or has a decreased level of consciousness, managing fever and pain with medications like acetaminophen, paracetamol, or other appropriate analgesics and antipyretics, controlling seizures with anticonvulsant medications, if they occur. In cases where the patient has difficulty breathing or severe weakness, respiratory support, including mechanical ventilation, may be necessary. Careful monitoring and measures to prevent secondary infections, which can occur in hospitalized patients, especially those with compromised immune systems or those requiring mechanical ventilation. For patients who develop neurological complications, rehabilitation services, including physical therapy, occupational therapy, and speech therapy, may be necessary as part of the recovery process. Continuous monitoring for potential complications such as brain swelling, aspiration pneumonia, or other infections is crucial.